It's 5 minutes past 3 on my end, and I want to officially welcome you all to this webinar. Um, um, my name is Peter, and yeah, I think we're going to kick it off right away. Um, Let me share screen. Okay, okay. Hey, yes. Okay. A thumbs up if you can see the slides. Okay, good. Awesome, awesome. All right, okay. Welcome to today's webinar. Um, it's titled Structures of Influence. And this is going to be a conversation between the Malawi Ministry of Health and Uganda's Ministry of Water and Environment. And this is a policy from practitioners. Um, I'm here to give us just a simple outline of our conversation. So I'm just briefly going to talk about ACRES and the LIPS project. These are the reason as to why we are here today. And I also want to talk about the evidence to policy training program briefly, because through this program, we are able to do this webinar. And every presenter on this webinar is actually a learner and a student. And then I'm going to give us a background of what we're going to talk about and the objectives we hope to achieve, activities that I'll introduce you to the participants. Okay, so starting off, the Center for Rapid Evidence Synthesis is a knowledge brokering institution that supports policy makers in a timely manner. And ACRES is a partner in the LIPS, the Africa LIPS project. And this is the Africa Plan to Advance Evidence and Equity in policymaking, to achieve the SDGs. And this is an initiative. This is the initiative through which we launched the Evidence to Policy training program. The main focus for this LIPS project is basically the gender equity at all stages of policymaking to equity. So in this LIPS project, ACRES works with different partners and specifically partners across Africa. And for us, we are specifically in the cohort of the East African region, and that is the East African Region Evidence Synthesis Initiative. It was established here, and through this partnership, we have been able to launch the Evidence to Policy Training Program, which I'm going to talk about. Now, the Evidence to Policy Training Program was an initiative that was put across due to a gap in the space of limited capacity and shortage of skilled EAM practitioners across the African region. And something we've observed is that there was a very high demand for evidence, and the labor that matches it was not quite matching the numbers. So the Evidence to Policy Training Program, it covers majorly three competency areas. There is the collaborative competencies, the technical competencies, and the cultural competencies. Now, these were a conclusion from a research that was made here at the center, and more details can actually be found at our website, which I'll be putting in the chat later. It goes over 3 levels, entry level, mid-level, and advanced level. And this webinar specifically is being hosted by learners at the mid-level. at the mid-level cohort, and we are really, really excited to getting this work. So, background to the work that we're going to be discussing today is that evidence from policy making has really developed in African countries, and everyone is actually talking about it, and everyone has actually seen has seen the importance of this. And we have seen that a lot of money has actually been invested in this initiative of by using evidence in our policy making spaces because of the associated benefits. However, I want to bring a piece of knowledge to our notice that Liberani 2023 mentioned that EAP is not only a technical problem, but it is also a political challenge. And that is where we're here to discuss the institutional structures in these two chosen ministries, and that is the Ministry of Water and Environment in Uganda and the Ministry of Health. But one thing to notice is that evidence structures in this context, we're not talking about the hierarchy and the organogram structure of the ministry, but we are talking about the formal and the informal mechanisms that determine how evidence is sourced, how it is communicated, and ultimately how it is used in the policy-making process. Here, we're not talking about the evidence itself, but we're rather talking about the pathway through which the evidence flows, through which the policymaker. And we are really looking at ways of having more effective evidence influencing structures in policy-making spaces. I know some people here might be policymakers, others college workers. I believe that you may give one or two things that you may take back, because we don't want to only keep it at a talk. We just want to institutionalize evidence, but we really want to take these things and put them into practice. We are not going to be celebrating success stories here, but it's just going to be an honest and comparative exercise and looking at what works, looking at what doesn't, what can be adopted from the policies. Since this is cross-disciplinary, I mean that is health and climate change and cross-culture, Malawi and Uganda, I think it's going to bring some very, very interesting insights. So what we're going to do, I'm going to take you through, I'm going to give you just a very small poll to respond to. And after that, we shall have presentations from Malawi and Uganda. And then afterwards, we shall just have discussions with our questions and answers as we go on. Our speakers today, we have Mr. Blair, Mrs. Suzika, Ms. Mheki, and myself, Peter Kasada. Mr. Blair is a reproductive health professional with over 22 years of working experience with the Malawi government across various levels of service delivery. He currently serves as the Chief Reproductive Health Officer overseeing the cervical cancer prevention and treatment program within the Ministry of Health's Reproductive Health Directorate. Nice to have you, Mr. Blair. Then we have Mrs. Suzika Lukanza Muntali. She is a public health specialist, currently working as a policy fellow at the Malawi Public Research Program Policy Unit. Her work focuses on strengthening the use of evidence in policy and practice through interpreting knowledge, translation, rapid evidence synthesis, and policy dialogues. She is passionate about promoting evidence-informed decision-making to promote health systems and public health outcomes in Malawi. It's nice to have you, Mrs. Suzika. And then we have Ms. Moheki Mariam. She is an environmentalist with over 12 years of experience in environmental management, climate change adaptation, and raising awareness for sustainable development. She's currently working as a climate change officer at the Ministry of Water and Environment in the climate change environment. She is committed to addressing the challenges of climate change through awareness, campaigns, mindset shifts, strategic action, initiatives, and collaboration with various stakeholders to ensure a sustainable future. It's very nice to have you, Ms. Moheki Mariam. And finally, myself, I'll be the moderator for this conversation. My name is Peter Kasonga, and I'm a research associate. I work with the Center for Evidence Synthesis. I am an environmental health specialist and a knowledge broker dedicated to advancing health, equity, and social economic growth. Yes, thank you so much for having me. All right, moving on, I am going to launch a poll. So I'm going to stop this for a second. I am going to launch a poll, and I'm going to request you all to respond to it in about 2 minutes. In about 2 minutes. It's not a very, very hard one. And it's just basically to give us. Okay. You can just respond to it. If you're not seeing it, you can find it in the chat. We're getting some really good responses. I see a lot of us are having a good day, which is very good. Yes, yes. The majority here are knowledge brokers. Okay. It's fine. If you're not so familiar with institutional structures, that's just okay. Okay. I'm going to give us 2 more minutes for those that have not yet responded. I see some people are just fine. Yeah, so sorry about this one, not feeling so good. We hope that this discussion will lift your spirit. All right. Okay, that's fine. That's fine. That's fine. Okay. 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 Thank you so much for taking part in that poll. It's to give us a sense of who is in this, who is here, and how the conversation should go is, and the language that we should use. But otherwise, I want to welcome Mr. Blair Sivale from Malawi. Please, the floor is all yours.
Thank you very much, the moderator, Peter, for introducing the call. Welcome. I'll take you through leveraging Malawi's knowledge brokering role to support reproductive health policy in Malawi. This is a structures of influence, a dialogue from the Reproductive Health Directorate, Minister of Health. So I'll do the first part. The second part will be done by my colleague, Sujika. Yeah, so quickly, we'll have an introduction of the Ministry of Health and how Reproductive Health Directorate stands within the ministry. We also have evidence structure within the reproductive health and a case in action. Yeah, that's the introduction of the HPV DNA testing policy in Malawi. So lastly, my colleague will take you through a collaboration where we leverage Malawi Liverpool Wellcome Trust knowledge brokering law to support the reproductive health directorate. Yeah, so quickly, the Ministry of Health provides leadership in delivering quality, equitable, and accessible health services to all Malawians. Its key roles are policy, planning, resource mobilization, and oversight of service delivery across all levels of care. It operates through various directorates, yeah, where we include the Reproductive Health Directorate, which leads programs on reproductive, maternal, neonatal, child, and adolescent health. So within RHD, there is evidence use. Evidence use is central to improving decision-making, accountability, and program effectiveness. So evidence informs policies, guidelines, strategic planning, addressing persistent health challenges, and ensuring resources are used efficiently. So this is just a diagram just representing an organogram to locate where the reproductive health is. So along other directorates, reproductive health does not work alone. It works hand in hand with other directorates like preventive, HIV, we have curative, public health. Yeah. So under reproductive health, we have adolescent health. We also have maternal and neonatal health. And we also have family planning. So what are the evidence structures within the Reproductive Health Directorate? Yeah, within the Reproductive Health Directorate, we have several structures. One structure is the Senior Management Team, abbreviated SMT. This is composed of directors, as you might have seen in the organogram. Directors, senior technical officers, and they discuss and approve technical recommendations. They also validate programmatic and policy proposals. Not any proposal or a policy issue can be implemented outside there without passing through the SMT. So we also have the technical working groups. So these are thematic and in various programs. They serve as main platforms for reviewing, interpreting evidence to inform the national RMNCA policies and guidelines. We have the partnership with the research institutions. Yeah, here we have the Malawi Liverpool Wellcome Trust. We have the WHO, we have UNICEF. These primarily access synthesized evidence and technical expertise. So we also have research and data units, which collect, analyze, and interpret reproductive health data to guide planning and tracking progress. In this one, we have the DHIS2 data repository, which is used across, and of course, the health information systems. So one other structure is the knowledge platform, where there are use of policy briefs, evidence summaries, and dissemination meetings to translate evidence into practice. Most primarily here, we're talking of the annual joint reviews by the ministry, where various programs are called to present their updates, their recommendations, and what is next within their program. So lastly, we have the decision-making support, where evidence feeds directly into policy revisions, program planning, and resource prioritization. So a case in action, we talk about the introduction of the HPV DNA testing in Malawi. Primarily, initially, we used to have the this is one method of screening for cervical cancer. Previously, we used to have the visual inspection with acetic acid, but with new evidence and the recommendations from WHO, there was a policy shift to introduce the HPV DNA testing. So there were several steps that took place. In the first place, we had to set the agenda. And there was evidence that showed that visual inspection with acetic acid was missing precancerous lesions, and the screening coverage and uptake remained very low. So there was need to adopt, according to recommendation, a high impact screening method. So there was evidence review and technical deliberations through TWGs. These were chaired by Reproductive Health Directorate and assessed evidence and global best practices. WHO provided global guidelines and recommended the HPV DNA testing as a high impact. So after the evidence, we had to formulate the policies through consultation. So RHD drafted a policy revision note and the new National Cervical Cancer Control Strategy incorporating HPV DNA testing. So after the policy, there was a resource mobilization and a partner alignment. This primarily, the developing partners took part. We had UNFPA, CHI mobilizing funds for procurement and the HPV testing equipment and the setting up the laboratories. So after mobilizing the resources, there was implementation and system integration. So RHD with the Health Technical Support Services oversaw equipment installation, training, and lab integration at zonal and the district levels. So a pilot rollout began in selected districts with a progressive national scaling depending on the results. So after the piloting, we had the policy enforcement through monitoring and continued feedback. We had ongoing data reviews. We have ongoing data reviews through the cervical cancer technical working group. So policy has been sustained, and now we have the HPV DNA testing going alongside the screening as one of the screening methods, alongside the using the acetic acid. So what were the ecosystems supporting this exercise? We had regulators who ensured the equipment and the reagents meet standards. Research institution, as already highlighted, development partners, civil societies who advocated for awareness, inclusion, and accountability, political structures for funding and oversight. Of course, lastly, the parliamentary and political structures that advocated for increased funding and oversight of the HPV rollout supported endorsement at cabinet level. We have two parliamentary committees which were used. Like we have the Parliamentary Committee on Health and the Parliamentary Committee on Budget, which were very crucial in rolling out the policy. Now, which were the challenges? In terms of evidence structure, there are several key challenges. Some of them, among them, are the fragmented data systems, where different programs generate data independently, as you might have seen on the organogram, and this limits integration. There is also limited capacity for evidence synthesis and translation, creating skills gaps in analyzing and applying evidence. Issues of resources, issues of limited resources, which include financial and human, they also impinge on the for evidence-informed work. So we also have a challenge on variable ownership and buying. Some district teams or program leads view evidence generation as donor-driven rather than integrating it into their planning. So mostly it's like they don't honor it, but wait for the central level to guide them. So in terms of solutions, how to overcome some of these challenges, like when fragmented data systems, we had to institutionalize, we have institutionalized the evidence platforms, e.g. through the technical working groups, which meet on a quarterly basis, where researchers, program officers, and partners regularly review data and inform program decisions. On a limited capacity for evidence, it has been invested in most of the partners that they should include a component to build capacity in the people in terms of skills to fill the gaps. On resource constraints, we have been partnering with some partners. Yeah, of course, they have their areas to support, but we still more leverage through the existing partnership support so that at least we are sorted out on this one. So next, I'll pass it on to my colleague to finalize on the collaboration. Over to you, Sozika. Thank you.
Thank you very much, Blair. And also thank you very much, Peter, for introducing us. So as Peter said, I'm Suzika Alakuzala Montali from the Malawi Liverpool Camp Program, and I work as a policy fellow. So maybe the question could be, where is Malawi Liverpool Camp Program fitting in from what Blair has presented? So if you had looked at the structures that Blair had presented, one of the evidence structures that is within the institution is that he mentioned partnering with research institutions and academia, and that is where MOW is falling. So I'll take you through the work that we've been doing with the Reproductive Health Directorate, and my presentation is very short, but before that, I just want to take you through the Malawi Liverpool Camp Program so that you understand what it is all about. So the Malawi Liverpool Camp Research Program, which I'll just be calling in short as MOW, was established in 1995, and its mission is to conduct high-quality research in order to improve health and also train the next generation of researchers in Malawi. In terms of the focus, MOW research focuses on several key themes, and there are also groups under those themes. But in terms of the actual themes, they include social science, maternal and newborn health, population health, vaccines, infectious biology, as well as health systems. So it operates in partnership with the Liverpool School of Tropical Medicine, as well as the Kamuzu University of Health Sciences locally here in Malawi. And it is based at the Queen Elizabeth Central Hospital in London. It also has an office in Lilongwe. That is where I sit. So within the MOW, that's where the policy unit falls. And in particular, the policy unit itself was established in 2018, and it serves us both as a support function within MOW, as well as an academic function. So in its support role, the unit helps MOW to connect with different stakeholders at national level and also decision makers. And it also influences policy agendas at all levels. And within the institution, it also acts as an intermediary or a knowledge broker that is linking the researchers within MOW with policymakers at a national level, as I've already said, so that it enhances policy impact and practice. So it is under this policy unit that the MOW has been working with the RHD department. So I'll take you through the work that we've been doing now with the reproductive health department. So the MOW policy unit specifically plays a very important role as a knowledge broker. So essentially what we do is that we act as a bridge between research and policy. And our focus is mainly making evidence usable and also accessible by policymakers or decision makers within the Ministry of Health. So we make sure that the findings that are there can truly inform health policies and programs within the Ministry of Health. And we've done this by facilitating regular policy dialogues and also engagement sessions between the researchers and the policymakers. And we have also created spaces where evidence and experiences meet. So apart from this, we've also been responding to agent policymaker questions, where we've so far produced rapid response briefs and evidence summaries that synthesizes research in a timely and practical way. And beyond that, And beyond that, we've also been involved in capacity building within the team and also within MOW as an institution. And also beyond that, we've also been participating in the evidence to policy training, which is why we are here. And apart from that, our policymakers as well, especially the ones that we're working with in the reproductive health department, have also been part of this training. So with this capacity building, what we're doing is helping policymakers and researchers to strengthen their ability to request, interpret, and also apply evidence in decision making. And also, through this collaboration and engagement with the Ministry of Health, we've also been able to build trusted and strengthened relationships that support evidence use and decision making within the Ministry of Health. So in terms of the actual partnership now that we have done, apart from what I have already said, is that our collaboration with the Reproductive Health Directorate is one of the best examples of how evidence brokering works in a real time or in a real world, where together we've been able to produce and co-produce the rapid response briefs. So these rapid response briefs, there was one that we produced on the causes of maternal sepsis, which was requested by the Reproductive Health Department specifically because of the currently released maternal death audit, which had shown that sepsis now is the #1 cause of maternal death, as opposed to how it was in the past, where the #1 cause of death was hemorrhage. So they had requested specifically for this evidence so that it can help them to make decisions within the Reproductive Health Department. So as you can see, together we've been able to co-produce these rapid responses that directly inform or respond to the policy and program questions within the reproductive health department. So another example is that we've also been working on exploring the causes of, we've also been working on assessing the impact of USAID's funding withdrawal on maternal and newborn health. As you all know that there's been a funding gap that has been created with the exit of USAID. So the Reproductive Health Department had also specifically asked us at MOW Policy Unit to conduct a rapid assessment so that we can see what the effects of USAID exit or withdrawal on supporting maternal and newborn health services has been. So we also did that, and we are about to finalize that brief so that we can support them with the evidence that they need in order to make decisions in terms of where they should channel the resources, what kind of programs should be prioritized, or what exactly should be done to ensure that the service continuity is still there despite the funding gap that has been created. So apart from that, just to say that to ensure that there's a smooth coordination and follow-up between us and the Reproductive Health Department, we also have a focal person that is within the Reproductive Health Directorate that we work with, and also that as MOW, we have been actively engaged in participating in the TWG within the reproductive health. So the specific TWG that we attend is a Safe Motherhood Technical Working Group, where just to also mention that we are expected also to present the results that we got on the causes of maternal sepsis to this technical working group so that we can inform them of our findings and also that we can spark a discussion from there. So this partnership basically just demonstrates how our sustained engagements, our joint identification of priorities, especially in terms of the priority questions that they had given us to respond to, and the shared ownership of the evidence process that we are doing are key in ensuring that evidence is both relevant and also usable within the ministry. And beyond the responding to the questions, our collaboration has also helped in strengthening the structures that usually makes the evidence generation and use possible within the Ministry of Health. So just also to continue that this has also reflected a relationship between us and the RHD, a relationship that is built on trust as well as responsiveness, so that whenever they have a question that they want us to respond to, we are readily available to respond to the questions through our rapid response help desk that was established within the policy unit. And finally, we see that this partnership is an investment in a long-term capacity, because apart from us as MOW staff attending the evidence to policy training, we have also included 2 officers from the reproductive health, so that they are also trained, and that through this evidence to policy program, we ensure that the ability to access evidence, or interpret or apply the evidence, also remains within the system that is beyond the project. So our collective goal is basically to ensure that we institutionalize the evidence use within the RHD and other departments, so that policy decisions in Malawi health sector continues to be guided by research long after the individual projects ends. For example, this is being supported by DIPS, but because we've also built capacity within the reproductive health department, we are sure that this will continue even after the LIPS project ends. So thank you. This marks the end of my presentation. Over to you, Peter.
Thank you. Thank you, Suzika and Blair. For now, since we're trying to catch up on some time, I would recommend that let us put the questions in the Q&A section, and we are going to respond to them as we proceed. I'm going to hand over to Mariam for the Ugandan part, and then we can go into the discussion. Over to you, Mariam.
Thank you, Peter, and my colleagues, Blair and Suzika from Malawi. I'm called Mariam Hechi. I work with the Climate Change Department in the Ministry of Water and Environment. And today I want to take you through briefly on the structures of influence for evidence-informed policymaking or decision-making, looking at the role of Climate Change Department in driving informed climate governance. And evidence is very key to our operations here at the department, because climate change is a science, and we rely on evidence heavily for our decision-making procedures and processes. I would like to take you through by introducing the Climate Change Department. I'll have a very brief overview of the climate change, and then the structures of evidence-informed policymaking. And then we shall conclude with a case study where we shall look at a case where we have utilized this evidence. Yeah, as I've already said, the Climate Change Department is within the Ministry of Water and Environment, and the ministry is the national institution responsible for climate change action in Uganda. So our department is basically to ensure that the commitments which we are a party to, the global commitments which we are party to, that is the UNFCCC, the United Nations Framework Convention on Climate Change, the Kyoto Protocol, and the Paris Agreement, that we strengthen the implementation of these conventions to make sure that as a country we are able to benefit from them. Also, we are in charge of coordinating, monitoring, and evaluating all climate change action in Uganda, be it from the state or non-state actors, be it from government or non-government programs, whatever has to do with climate change, we are in charge of that mandate. Briefly, the CCD department is in charge of development and transfer of climate friendly technologies. We are also a national climate change information and knowledge center. We also promote multi-stakeholder engagement in our climate change processes. We also support districts in development of their climate change action plans, and we encourage green growth development. So we support initiatives and interventions that are geared towards that. But also, most importantly, we are in charge of coordinating the measurement, reporting, and verification of emissions, which also translates in our National Climate Change Action Plan, also known as the NDC, the Nationally Determined Contribution, which informs the interventions that we can have as a country in order to meet the Article 4 of the Paris Agreement of limiting the temperature rise to below 1.5 degrees. So coming from the section where climate change outreach is key, allow me just briefly explain, because I know in attendance there are many people maybe who are not even from the climate change field. But when we are talking about climate change, we are talking about the greenhouse gases which trap infrared radiation and then withhold it in the atmosphere, causing what we call global warming. And now climate change, because of this global warming, we have had climate change impacts because the atmosphere and whatever was there before the pre-industrial season has changed. And this is largely actually attributed to human activities. Because of what is happening, the atmosphere, all the natural processes have shifted. There's a shift in what is taking place, both in terms of intensity and in frequency. We cannot talk about climate change without talking about mitigation. We cannot talk about climate change without talking about mitigation, adaptation, and other means of implementation. So in mitigation, we are looking at limiting the greenhouse gases or increasing their absorption from the atmosphere by creating carbon sinks. While in adaptation, we are just looking at how able we can cope with the happening impacts of climate change. So in means of implementation, we look at technology, capacity building, finance, and gender. And these, I would like to indicate to you that these themes that you see here, when you hear of COP, this is the Conference of Party under the UNFCCC. Usually it is an annual global event that countries who are parties to take turn in hosting. So every time you hear of COP, there are negotiations around these 6 themes of mitigation, adaptation, technology and transfer development, capacity building, finance, and gender. So looking at the existing structures for evidence generation, these are some of the structures that we use here at the department to generate evidence. We have the climate analysis, and this climate analysis is strictly 100% scientific evidence. We rely on the Department of Meteorology to give us the climate variables. Climate variables, those elements of climate, looking at temperature, looking at rainfall, humidity, and such. So the meteorology department is the one that is in charge of transmitting this information, and also seasonal changes in these variables. We have the needs assessments, and these are both in terms of capacity and technology. We go to the, because at the end of that, the climate change affects the people on ground, the people at the grassroots, the communities. So we usually interact with people from the district to identify their needs before any rollout is made, to make sure that actually whatever planning is made is informed by their needs. By the needs assessment, the outcome of the needs assessment helps us to inform their planning. So we work hand in hand with UBOS, Ministry of Local Government, that is at the district level, research institutions, and National Planning Authority. We have mitigation assessments, and this basically, like I've said before, when we talk about mitigation, we are looking at greenhouse gases. So we are looking at the baseline studies. We look at what was the emissions before, then what are the emissions now, then what are the projections. You can give it a time frame as you would like, depending on what your interest is. And there we work with academic and research institutions. We have also people who are accredited. They are mitigation experts, because these studies, these assessments, especially for mitigation, they're not for everyone. There are people who are accredited to carry them on. We also have the greenhouse gas inventory and database, which is housed here at the department. And this one we regularly conduct monitoring and verification to ensure that the information we get is updated. Then gender analysis, and like because climate change is cross-cutting, gender issues have also been incorporated for the mainstreaming. And usually the gender analysis, we work with the Ministry of Labour and Social Development plus Equal Opportunities Commission. So once we have generated evidence or information from these studies, these assessments and studies that I've hinted on, we have bodies or platforms that review or summarize and translate this evidence into usable information, or what we could call policy briefs. And we have in the department, we have technical working groups. And I'll give an example, like already there's, because there's an ongoing update of the NDC 3.0, we have a technical working group in that area, which is to basically direct and make sure that this information that is collected from the different sectors is reviewed and translated into useful policy briefs. We have the project steering committee. These are for many projects which are around the department. We also have the program committee, the natural resources, environment, climate change, land and water resources management. This is the program under which the climate change lies, and it is in the program for the national plan development programs. We have the internal technical reviews. We also have validation by the NAC. And NAC, these are the advisory body. So overall, we have this as the advisory body. NAC is the National Climate Change Advisory Committee, which reports direct to the minister. Then we have the Policy Committee on Environment, and then the cabinet. So with all these structures, you look at these pictures on the right, with all these structures in place, that's where we aim for these pictures on the right. Energy efficient, and maybe if I can sum it up, basically climate resilient cities. So we also have the monitoring, evaluation, and learning units, which are in charge of tracking implementation results to make sure that we are on track. We also have the information system that I talked about, the greenhouse gas emissions inventory, which is for storing, and it supports access of climate data. It supports access, like whoever wants, I mean, it is public information. Anyone who wants this information, they're able to access it. Then we also have stakeholder engagement and collaborations. And under here, we employ the whole of society approach. We have the ministries, departments, and agencies. And there are so many ministries we're working with. There's just like my Ministry of Agriculture, my IF, Ministry of Transport, Energy. So there are those ministries that are very key to climate change, and we make sure that we work with them. We have private sector, we have NGOs, we have CSOs and development partners, plus academia and research institutions. So looking at where we are coming from, I would like to share with you this case scenario of the climate risk vulnerability, the climate risk and vulnerability assessment, the CRVA. These climate risk vulnerability assessments actually are supposed to be, they are supported by the Climate Change Act. It is the duty of all districts in the country to make sure that they have district action plans. And these district action plans, they are informed by these vulnerability risk assessments. So these assessments, they employ both scientific and community evidence. And in scientific evidence, like I had said, there is the part for climate analysis, which I said is 100% scientific. We rely on the projections and information given by Department of Meteorology. But then there's the community evidence structures, which is largely socioeconomic. And here we have been able to go to 12 districts to make sure that we get their vulnerability indices and make sure that the planned interventions speak to their climate change impacts, because these climate change impacts are not general. Different areas, different regions experience different impacts, and also they experience these impacts in different levels of severity. So you might find that the intervention that is needed in a district varies from an intervention that is needed in another district. That's why we go on ground and we make sure that we generate these vulnerability indices to make sure that the interventions provided for speak directly to the communities. And here, the end result of the CRV is we have the district climate action plans, because they are informed by these assessments. We have the vulnerability indices, which in turn inform the NDC. And this NDC, like I've already said, yes, it is our national action plan, but it is a requirement for all countries which are party to the Paris Agreement to make sure that they have the NDC, which is regularly updated. Regular, I mean every 5 years, this NDC, the National Climate Change Action Plan, is updated. This speaks to our commitment in terms of emissions, what we are able to do as a country. Then we also have area or sector-aligned interventions, like I've said, for the different communities or parishes, even going down, by the way, to the village level. So these are just the pictorial evidence of how this data is generated, then later is transformed and into meaningful information. And these are some of the identified climate smart interventions at community level, what the local people are using on ground. So, as you all know, of course, challenges are part of life, and we cannot talk about successes like as if it is seamless. As a department, there are challenges we have encountered, and most of these speak to capacity, limited capacity, both in terms of technical and equipment for data generation. especially things to do with measurements of emission. There are challenges here because there has to be equipment, there has to be also capacity to be able to interpret this information and actually make it useful. We also have competing priorities. Yes, sometimes evidence is saying this, but competing priorities take over. Then, of course, there are issues to do with limited funding. Now, like this case scenario I've talked about, every district is supposed to be having the district action plan informed by the climate risk vulnerability assessment. But we have already we are compiling for 12 districts, but others have not yet even started. So because some projects have prioritized some districts over others. Then we have political interest. This one I'll not talk about it because this is almost across the continent. And then hierarchy and bureaucracies, which slow down the implementation of this evidence informed decision making. You find you're moving from here to here, then in circles, and basically it slows down the time of implementation. That is it from me. Thank you for your attention.
Okay, thank you so much, Mariam. Thank you so much, Blair. Thank you so much, Suzika, for the presentations. It has been a very long journey with all this with the conversations coming in. And I think it is now time for us to open up the discussions. And I'm actually going to start with Blair and Suzika. I'm going to open up the chat also for participants to be able to ask questions and come up. So Blair and Suzika, there's a question here. It's in the Q&A. Mr. Edwards says that he has observed that in many cases, the time given to the technical working group meetings is typically limited to allow deliberation using evidence on different policy-related discussions. How are you approaching your place in the technical working groups to ensure that evidence is actually used to guide these discussions, given this major limitation? And I'm only giving you only 3 minutes to respond because we're about our time. 3 minutes. And also Mariam will respond.
Yeah,
only 3
thank you
minutes.
for thank you for that question. Indeed, as you have also heard from the two presentations, even that from Mariam, indeed, sometimes in the technical working groups, there are different interests, and sometimes they leave issues, some critical issues are left hanging. But in our case, as I indicated earlier on, we have these TWGs into thematic areas so that if at all we have the partners who come into these TWGs, should be partners who are also doing their program, or they are doing their interventions. Yeah, they are related to what is being championed by the TWGs. So these are on a quarterly basis, and the readership is also very critical to ask for minutes of the meetings to see how the action points are moving. So in such a way, we are kept abreast to follow up on issues that might be hanging. So we also have donors and partners there who have read the answers during such meetings. So yeah, the main issue there is to make a proper follow-up, make a proper follow-up, share with leadership to share with leadership to have their support, because if they are aware, they have evidence, they are able to support the cause. Thank you.
Okay. Thank you so much for that response. Mariam, in 1 minute, if you have anything to add, how do you guys ensure that technical working groups, with that limitation of not having enough time, how do you guys work?
Thank you, Edward. And indeed, that's true. There's limited time. And what has also been the challenge is convening these technical working groups to keep meeting and work. So right now, what is being done is we thank God for technology. People are able to meet online. People are able to use their emails. I must confess, emails and usually the responses, they are a bit slow, but at least people are trying to come up compared to the physical convenings. So that is what is helping us. Yes, it is still slow, but at least there's something being done about it.
Okay. Thank you so much for that response. Chat, the floor is now open. If you have a question, you can raise up your hand, and I can try to see. I want to come back to Blair and Suzika. There was a question here in the chat that I found quite interesting. I think it came from Geo. Yes. 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 Yes, it read what other evidence products are you producing besides briefs, evidence briefs, and rapid responses? And this is because of rigor versus speed. As researchers can consciously sacrifice gold standard methods, e.g. extensive sampling and complex analysis for speed, risking the generation of weaker, less generalizable evidence. So what products are you guys trying to, are you guys working with to ensure that the evidence is rigor, to ensure that despite the limitation of wanting speed, that the evidence is validated, is valid, and it's strong enough to inform policy?
Thank you, Peter.
You have 2 minutes. You have 2 minutes.
All right. Okay. So to begin with, what we are working on at the moment between the policy units at MOW and the reproductive health director is only on the rapid response briefs. It's because we're working through what we have established as a rapid response help desk within MOW. So we are only responding to agent questions. So by saying agent questions, we're also providing rapid evidence. So our turnaround time is about 28 days. Obviously, we can't conduct something like a primary research or a primary study. So what we are doing is only to provide the rapid response brief, but be assured that the methodologies that we are using to access the evidence, to appraise the evidence, really have the rigor in it, so much that the evidence that we're producing is from the systematic reviews that are already published, is from the papers that are already published, and the methods that we are using at the moment are good. But in terms of supplementing it with primary study, I just want to give one example of the rapid response brief that we're working on, the one that we're working on assessing the effects of usage exit, because it was not possible to find much of that information online or published studies that have that online. What we did was to supplement that with a primary study where we were collecting data from all the districts that we support, were being funded by USAID, and to collect the data that would really inform the decision making. Thank you.
Okay. Thank you. That is actually very good. That was actually a very, very good question, Jill. And it really brings to light the policy, the evidence and policy issues, especially when it comes to the quality of the evidence. And me personally, as someone from the ECAS, from the Center for Rapid Evidence Synthesis, and that is our major flagship, which is the Rapid Response Service. And the Rapid Response Service mechanism, what it focuses on firstly, identifying a very specific problem and looking for the best available literature. We majorly focus on systematic reviews, which wherein we can actually look at the weight of the different papers from the systematic reviews. But additionally, if the evidence is not strong enough, we can do some primary conversations. We call them citizen panels, whereby we talk to we go back to the citizens and have conversations with them on these matters, on these issues, so that we can validate our evidence. Okay, I'm moving on to the next question, and I think this is a very interesting conversation. If you have, again, I reiterate, if you have a question, don't feel free to raise your hand, and I can see. So there is another question here. It came from Edward earlier in the call. This one I'm going to give it to Mariam, but Blair, you can also chip in if it says specifically, what are the structures within the ministry that have not been explored or that have potential to support evidence to policy initiatives? What are some of those structures? And this I can also add on in a way that, well, okay, maybe what is something that you have seen in Blair's model that can work in your political context, and vice versa. But let us first look at what are some of those structures that have not been explored. You have 2 minutes, Mariam.
Even one is enough. Anyway, looking at the Malawi's structure, and also which will answer this question Edward raised. I think Edward, yes. The one structure or one model that I think could really work for us, which is lacking. Okay, it's not entirely lacking, but I think we have been using it the other way around, somehow contributing to it. But it is the knowledge, having the knowledge bodies or blockers on board to work with directly with the department. This speaks to our department. For us, most of the time, okay, we don't have like those knowledge bodies or hubs or research institutes that are affiliated to the department to work with. So most times when we are going out for these assessments and generation of evidence, we usually contract consultants who are experts in that field, but we don't have like those knowledge bodies are attached to it. Then also another thing that another concept that I think could also work is having the policy innovation hubs, basically to test and evaluate these policies before they are actually implemented. Yes.
Okay. Thank you for that. And I think that is something that we should actually really put a bit of a mind on. Ministries that, or probably some departments that are not working with a knowledge brokering institution. You might have the capacity, which is really good, but I have observed that sometimes without that capacity, you might find that the evidence of what you're looking for is already available. Yes, but then again, you go and again, you spend resources in finding information that is already available in the literature. So I think it's imperative. Okay. Thank you so much, Mariam, for that response. I'd wanted. Okay. Fine. Okay. Moving on. Do we have any burning questions from the audience? Are there any burning questions from the audience? Okay. I don't know if
No questions.
Okay, fine. I do have some other questions. From the comments, and they have actually really been coming in. And this one goes to Mariam once again. Yes, it actually came from Jill. it's so on climate change, vulnerability assessments, evidence dictates where adaptation strategies. I don't know if I've read that well. Vulnerability assessments, evidence dictates where adaptation strategies. Yeah. So evidence and sectoral integrations is evidence being used to integrate climate risk into their budgets and operational plans, moving climate change from a standalone issue to a cross-cutting element of development.
Thank you, Peter, and thank you, Jill, for that valid concern. I would like to inform you that actually previously climate change planning, budgeting has not been receiving so much attention, but moving on, like currently, over recent years, maybe 3 or 2 or 4, all ministries, not all ministries, all programs as per the National Development Program, NDP, from NDP 3, moving on to NDP 4, they are required to incorporate climate change planning in their programs and sectors. And at the end of the day, they share their plans, their budgets and frameworks, and we are able to quantify if these plans if climate change has been integrated into their plans, and they will receive a certificate of compliance for this assessment. So this is just to indicate to you that yes, much as evidence has not been used like to dictate the adaptation strategies, there is effort, because right now initially there was no even planning. All programs would submit as to how they please, but currently all programs there must be the element for climate change planning in their programs. So at least we know in that way there is money, or there is finances or resources secured to make sure that these adaptation strategies which have been identified by evidence are implemented.
Okay. All right. That's very good. And unfortunately, I think Blair dropped off for a second, but I believe he'll be back. So this question was actually going to Malawi. There are actually 2 of them. So I'll let Susika be respond in her capacity. If Blair comes back, we shall also ask him to respond. So the question is that what has been the impact pathway thus far for the work done by Malawi towards supporting the use of evidence within the ministry, and what have been the major challenges along this pathway?
Thank you, Peter.
I can read it again. We can't hear you. Hello. Hello, Suzika. Hello, Suzika. We can't hear you.
Hello, Peter.
Yes. Now we hear you.
All right. I was saying, can you come again on the second part?
Okay, so the second part is what have been the major challenges along this pathway. Okay, overall, we're just asking about what's been the impact pathway for for the work done by Malawi or by the Malawi Wellcome Trust towards supporting the use of evidence within the ministry, and what have been some of the major challenges along this pathway?
All right, thank you. So let me start by saying that apart from the rapid response briefs that we are doing at the moment, MOW has been working with the Ministry of Health for a long time. So it works with the Ministry of Health through the different research groups or the things that it has under the programs. So for example, it has also been working with the maternal health group within the MOW, which has been supporting several initiatives within the reproductive health department. And one of them that I can remember on top of my head is that it is also involved in the production of the maternal death audit or inquiry reports for the reproductive health department. So those are some of the things that the maternal health group has been working together with the Ministry of Health. And apart from that, apart from the reproductive health department, MOW has also been working with the different departments within the Ministry of Health.
Okay, all right, thank you. Mariam, what is the political economy of evidence used in climate change? There was a question in the comments here about how how the political economy structure is standing your funding efforts and the political pressure associated with it, and how are those pathways running?
So for on our side, climate change, I will still say, has not been getting a lot of attention until evidence of these climate change impacts was experienced. And at least now everyone seems to be on board because they know what is happening. Even if it is here at office level, you may not be a farmer, but you get this food from the farmers who are experiencing shifts in their climate, in their rainfall and seasons. Like basically there are those seasonal shifts. So somehow everyone gets to understand that yes, climate change, these impacts are real, and it doesn't take so much effort to convince the politics behind this. So in a way, even before, even when you present this evidence, those that would have neglected it are quick to attach to it because they have got this evidence. Besides being scientific through the statistics and the assessments done, it is also hands-on, like they live with it, or the chorus around the different entities and partners, what they are saying. So it becomes easier to convince them, even for funding and donor support.
Thank you for that. I'm going to ask Suzika one question, and then afterwards I'm going to ask you two questions, for a question for the both of you. Suzika, there's a question for you. What are the main triggers for evidence used in Malawi? With your partnership with the ministry? Considering your partnerships with the ministry, what are the major evidence triggers, evidence use triggers?
Hello, Peter.
Yes, hello.
Sorry, I had lost connection for a second. I was saying, of course, there are several triggers. One of them that I can say is that for the question that we are responding on the effects of USAID's exit was basically because of the donor shift that happened. That is why they had asked a question for us to. Are you able to hear me?
Yes,
Yeah.
please, I hear you.
Right, so, okay, so I was saying the whole reason why we were asked that question was because of the donor shift. So that can also be considered as the reason why they had requested for evidence, because they needed to make decisions within the RHD department in terms of where should they focus most, where should the available funds that are there go, who should be supported more, which districts should be supported more than the others, especially the districts that were mainly being funded by USAID, and also decisions in terms of which services should continue and which services should not continue at the moment, or where should we go and look for other funds to consider still implementing the other activities that haven't been implemented. So yes, donor shift could be one of the evidence triggers that could be there. And also if there's an urgent policy needs or question that requires evidence, they can also be looking for evidence to support that. And another, I think, evidence trigger could also be a health challenge that can happen at the moment. Yeah, thank you.
Thank you so much. Thank you so much about that. Maybe one thing that I just wanted to also highlight on in terms of a health issue are those indicators that come up. You know, certain policies are put in place, and then they're supposed to do A, but B is happening. So some of those things are really major evidence triggers. And so I'm going to ask one more question for the both of you. So I'm going to give you, I think, 2 minutes, and then we conclude, since we're out of time. One, I'll start with Mario. The question is, what would you call success in relationship to the access and use of evidence? And in your experience, what has worked, what has not worked, and what would you adopt? Those are 2 in 1, I guess.
That's a mouthful. Anyway, yeah. What would I consider as success?
Consider success in the context of evidence to policy.
Evidence to policy. Success. One, what I look at as success. Okay, what measures as success to us at the department level is when we use this information, generated to make policy briefs that actually speak to the people on ground, and then the people are able to adopt them. So what measures as success is the adoption, or call it uptake of these, adoption, uptake, and implementation of these measures or interventions. That already measures as success, because you have used these interventions. They are not generated from they are not generic. They are coming from the people who actually need them. And that also measures to me what I think works is going down to the people that need these interventions and actually form interventions that speak to them. Otherwise, it will not work, because it does not make sense to them. And at the end of that day, if someone does not find an intervention speaking to them, speaking to their use, speaking to their livelihood, it will not work.
Okay. Thank you so much, Mario. And over to you, Suzika.
Thank you, Peter. So to answer your first part of the question, what would consider a success from our side would be that the evidence that we have produced is being used or incorporated in decision making. So what would consider success is when the government, or for example, we're working with the RHD, if the RHD is able to take up the evidence that we've provided to them and be able to incorporate it, whether it's in new strategies or updating guidelines or making decisions within the department, that is something that we can consider as a success. So the second part of the question, where you were asking what works, in terms of what works from our side, it would basically be the co-creation that we are doing at the moment. For example, in terms of the briefs that we are producing, we are co-creating the briefs together with the RHD. So we are working with them from the moment that we are coming, well, when they have given us a question, we clarify the question together and we go through the whole process together. And apart from that, there've also been a couple of stakeholder engagement meetings that we've had with them. So we've also seen that that has really worked. So apart from that, we've also seen that another aspect that has worked is having a focal person within the reproductive health department, who is mostly like a liaison person between us and the reproductive health person. So having that dedicated person has really helped us to have an entry point in the reproductive health department, so that whenever we want something from the department, whether we're looking for documents or we are looking for something very quickly, we can actually reach out to them because we've built a very good relationship with them. So that is what I can also consider as what has worked from our side. Thank you.
All right. Thank you so much. Thank you so much for your input. I want to appreciate all our speakers, Mariam, Suzika, and Blair. And I just want to thank you all for all these efforts, and also the attendees. Thank you for registering, and thank you for coming to join us in this conversation. I know it's interesting, and there are a lot more questions that are there, and that the discussion can continue in our own groups. Otherwise, I want to wish you a very good evening, and to also say that let us to also continue with the mind of acting on these things. Let this discussion not end here, but let us continue challenging ourselves, challenging our systems, challenging our evidence to policy systems, so that we may create more effective methods. Otherwise, thank you so much for coming in. Have a lovely evening. Have a lovely morning and afternoon across the world. Bye-bye.